This is the same patient as I described previously after a few days. As you can see, the patient has undergone surgery for evacuation of the epidural hematoma on the right side. And so we see some air and blood products on the right side. Now, this collection is no longer confined by the dura, and therefore it is crescentic in shape and therefore represents a subdural hematoma in the postoperative setting. You notice that over the course of time, the patient developed parenchymal hemorrhages in the left lateral temporal lobe, seen on the image on your left-hand side. And this is not unusual to have a contusion that occurs. You also see that the patient has developed a subdural hematoma along the tentorium. This is often better demonstrated in the coronal plane, but you can see that extra density on the right side compared to the left side, representing a tentorial hematoma. As we go further inferiorly, you notice that the blood products have collected along the left cerebellar hemisphere. So this patient has a significant amount of damage to the brain with an epidural, a subdural, an interhemispheric subdural hematoma. We had the tentorial subdural hematoma, all in the same example. I want to show the MRI scan. This is the susceptibility weighted scan of the MRI scan, which is our best technique for demonstrating blood products. And anything dark here would be either a vein or blood products. As you look at the tentorium, you can see that there is this black rim around the edge of the tentorium. What we're seeing is the superior vermis with blood products in the sulci of the superior vermis, as well as blood collecting along the tentorium. Here we have our postoperative state with blood products collecting the extraaxial compartment, and there's also blood products in the extraaxial compartment overlying the left posterior frontal and parietal lobes. Here is the parenchymal hemorrhage that is demonstrated on the MRI scan as an area of dark signal from deoxyhemoglobin. There's one more finding on this MRI scan that is noteworthy, and I want to go to the diffusion-weighted imaging. This is the diffusion-weighted scan. What one sees on the diffusion-weighted scans are lots of small areas of high signal intensity. Blood products, unfortunately, on diffusion-weighted scans can sometimes simulate cytotoxic edema. Normally, when we look at the diffusion-weighted scan, we're looking for the presence of high signal intensity that might suggest acute ischemia or a stroke. I'm going to go to a 211 and bring up the ADC map. And these areas of high signal intensity on the diffusion-weighted imaging are not corresponding to low signal intensity areas on the ADC map, and so they likely represent blood products in the subarachnoid space. Now contrast that to this area. So here we have a very bright area in the splenium of the corpus callosum on our diffusion-weighted imaging, which corresponds with dark signal intensity on the ADC map. So this is indeed cytotoxic edema. Bright signal intensity on DWI in the splenium of the corpus callosum can be due to a variety of causes. The most common cause in this situation is a patient who has had a shearing injury of the splenium of the corpus callosum. In this case, what I would do is I would look at our susceptibility weighted scans and look for blood products that would indicate hemorrhage in the splenium of the corpus callosum. There are a few tiny dots here, and therefore that is a possibility. The other possibility is that the bright signal on the DWI in the splenium could be due to the institution of anti-seizure medications. It's not unusual for patients who have had head trauma to be placed on anti-seizure medications such as Keppra, which could lead, which is due to the irritation of the brain. That is the etiology for the seizures, that is blood products in the brain. And in this instance, given the relative lack of hemorrhage in the splenium of the corpus callosum, I would suggest that this is most likely due to the institution of anti-epileptic drugs, and look in the EMR, the electronic medical record, for that. If the patient was not seizing and was not on anti-epileptic medications, then we would suggest that maybe this is either non-hemorrhagic shearing injury or due to the trauma, or less likely an ischemic injury.